These muscles, or Kegel muscles as they're popularized, are muscles that help propel that ejaculate forward. So you can strengthen those by doing Kegel exercises, which is essentially like that feeling where you try to stop your pee when urinating, or if you're trying to hold in a fart, that's when you're using those muscles, or it's like trying to lift your penis off the ground without touching it. Welcome to today's episode of Ask Me Anything. This is where I answer your questions. And if you want to be able to ask me questions and have them answered here, check out our membership at renamalik.supercast.com, where you can leave questions for me to be answered, and you'll get to see the entire episode of Ask Me Anything.
And remember, guys, please do comment on these videos. Please do comment on the social media, on the Instagrams, on the Facebooks. All of it helps. That's where we gather some of the most written about questions. We do read these comments. We do read some of the topics. Some things come up more often than not, and that supplies us with what questions people are thinking about, and it helps us make the content that you guys care about. All right, let's get right into it. What gives? Sometimes when I ejaculate, I make a lot of semen. Sometimes even after a week of not masturbating or having sex, when I think it's going to be a lot, only a small amount comes out. Why is it so different every time? This is from Zeely from Marietta, Georgia.
All right. Well, this is a good question. So ejaculate volume can range from time to time. The average amount of ejaculate a person makes is anywhere from half a teaspoon to a full teaspoon. So it's not a lot, between 1 and 5 mLs. I know you guys see these large volume ejaculates on erotic films, and that's really not real life, unfortunately. So what happens is we think a lot of people get worried, like, are my sperm problematic? Am I not making enough? Is there some issue? But only 5% of your entire semen volume comes from sperm. The large majority of it is made and stored in the seminal vesicles, which are these sac-like structures that sit behind the prostate. Another small percentage comes from the prostate. So that's where the large majority of the volume comes from. Now, the number one reason that people often see variability is between how long it's been since you've ejaculated. So if you ejaculated more recently, you may notice you'll have a lower semen volume, whereas if you've gone longer periods of time, then you will have a larger semen volume. But there's a whole host of other factors. It can include things like genetics. It can include things like how well hydrated you are, how strong your Kegel muscles or your bulbar cavernosus muscle is, and we'll talk about that briefly. It can be due to, if you're deficient on certain minerals like zinc, for example, which is very high in concentration in the prostate, that can affect it as well. So it can vary from time to time, as well as smoking. If you smoke, that's going to reduce your semen volume. So what about that bulbar cavernosus muscle? So that is a muscle that's around the urethra that contracts. And when it contracts, it helps propel forward the ejaculate. You may wonder, I used to have this really strong, forceful ejaculate, and now it just trickles out, or it may just be not as strong as before. So that can also make it look like you're making less, because usually when you're young and healthy and those muscles are strong, you can have a forceful ejaculate that's anywhere from 30 to 60 centimeters away from your body. Whereas as you age, that muscle tends to get weaker, and that decreases by about half. And so some people even describe it as a trickle. So that's where these muscles come into play. These muscles, or Kegel muscles as they're popularized, are muscles that help propel that ejaculate forward. So you can strengthen those by doing Kegel exercises, which is essentially like that feeling where you try to stop your pee when urinating, or if you're trying to hold in a fart, that's when you're using those muscles, or it's like trying to lift your penis off the ground without touching it. This is not something that everyone should do. If you're having pain, if you're having more urinary symptoms, like you're going to the bathroom more often, more urgently, more frequently, if you're having constipation or back pain or hip pain, this could exacerbate those things. So talk to your urologist, talk to your regular doctor before you start doing these exercises, or you could try them, but if they exacerbate any of those things, stop. You may be actually making things a bit worse.
30 to 60 centimeters, you say?
Yeah.
Wow. You learned something new. Bulbar cavernosus muscle. Learn something new. All right. I don't like to take pills, but I want to increase my testosterone. What are some natural ways for me to do this without pills? Ron from Nebraska.
Ron. All right. So increasing your testosterone. So first of all, testosterone is a hormone. It's a sexual hormone, but it's important for a lot of different things. It's important for brain clarity. So people who have low testosterone will describe brain fog. You might see that you're decrease in muscle mass. You may have your mood feeling more depressed. You may notice that you're feeling more fatigued. And then you may notice your libido has decreased. But most often people think of testosterone as like muscle building or testosterone and erections. But there's a lot more to testosterone than that. And so if you're having symptoms of low testosterone, I encourage you to get that checked out. But everyone can benefit from these natural ways to boost your testosterone. So first and foremost, a big one is sleep. And so it's not just how much you sleep, but the quality of your sleep. So we know that if you get more improved sleep quality, meaning you're sleeping a good 7 hours or more, it's uninterrupted, you're not having things that disrupt sleep quality, like having a lot of bright lights before bedtime, you're not having a lot of alcohol before bedtime, you're not having a lot of caffeine, even within 6 to 8 hours of bedtime can disrupt the sleep quality. And everyone's a little bit different in terms of how quickly they metabolize caffeine, but the average person, it takes about 6 to 8 hours to metabolize caffeine, half of the caffeine in your body. So if you have it at noon, at midnight, you're still going to have some on board. So improving your sleep quality is really important. In fact, we've seen that in men who have improved sleep quality, you'll see a boost of testosterone after they've had improved sleep quality. Okay, the second thing you can do is resistance exercise. So if you do certain resistance exercises, particularly those of the lower extremities or the large muscle groups, you're going to see an increase in testosterone. Now, this is not going to give you a permanent increase. You need to continue doing those resistance exercises to see the continued improvement. Now, interestingly, aerobic exercises can be helpful as well, because we know that having at least 150 minutes of mild to moderate intensity exercise can be beneficial for things like erections, and they can help with, overall cardiovascular health. But if you're doing really intense, high stress exercises, you may actually decrease your testosterone, because what happens is when you're stressing out your body, your cortisol increases, which then tells your body that, you're in a stress mode, and it decreases your testosterone. Next thing is diet. So there's a lot of conflicting data on diet, but the best data we have is for the Mediterranean diet. And that includes a lot of vegetables and fruits. It's a very plant-forward diet. That doesn't mean there's no meat. You do have healthy fats like olive oil and avocados. You have nuts and seeds. And then you can also have things like lean meats and fish, and then a little bit of red meat. So ultimately, it's a very whole foods, plant-forward diet. It avoids processed foods, and that has been studied to be the most beneficial in terms of testosterone and other sorts of issues like cardiovascular health and erectile dysfunction. So we've got sleep, we've got exercise, we've got diet. Now, the other thing is you want to avoid endocrine disrupting chemicals. So things like plastics in your environment. Now, I've made a whole video about this on my YouTube channel about endocrine disrupting chemicals. I don't want to make you scared, right? I think that in general, they're very ubiquitous all over the United States, all over the world. There are things that are used in manufacturing and in the products that we use every single day that have some component of endocrine disrupting chemicals. Does that mean you're doomed? No. I think it's all about the dose that makes the poison. So you want to limit your exposure to these things. Really, the people who are at the most risk are those who are working in these manufacturing settings, because they're getting exposed to the most of it. And so if you find yourself working in those settings, then ideally sort of limiting your exposure by wearing safeguards and things like that to limit exposure is going to be helpful. What I tell my patients is drink from metal or glass water bottles, avoid heating up things in plastics, and do your best to use sort of natural products like cotton and less synthetically manufactured products as best as you can. But again, stress is not going to help you in terms of anything. So limiting stress overall, whether it's from high endurance activities or other things, is going to be beneficial for testosterone.
All right. Sounds natural. Sounds good. I also want to remind folks that joining the membership, we do have an AMA question section there, and we do look there first to try to find ideas for questions. And if it's a good question, we will use it for the show. So please do consider the membership if you want to ask some questions as well. But let's get into the next one. I have never given my boyfriend or any man I've slept with a prostate massage. I feel weird going into the butt. I've had a female cousin of mine tell me she's tried it with her husband and that he enjoyed it. What do I need to know if I want to do this? Sheila R.
All right, Sheila. So in terms of, it's funny, I have a friend with the same initials, Sheila R. I wonder if it's her. Sheila, good question. So first of all, I'm assuming that your partner wants to have a prostate massage, but of course, consent is absolutely necessary. So, just because you've heard that some guy likes it doesn't mean that you should go ahead and do it with your partner without asking for their permission and their consent. Then what is a prostate massage, right? As you mentioned, it's putting a gentle, well lubricated finger or gloved finger into the rectum to feel the prostate. So generally the way that you would feel the prostate is you would have your partner bend over, you'd insert your finger into the rectum, again, very gently, very well lubricated, and then you push down and you feel the prostate. It's sort of a spongy tissue. It feels like the tip of your nose. You feel that area and then you gently massage it, right? And it's sort of a walnut shaped organ. So you massage one side, then the center, then the other side, sort of just gentle strokes of the finger. And some people find that pleasurable because there's lots of nerve endings there that are sort of going towards the penis, towards the erectile tissue. And so it is very reasonable if your partner wants to and you want to try it, to go ahead and try it. Now, if anything's painful at any time, of course, absolutely stop. The big contraindication for this would be is if they're having an active infection in that area, which they would know. They would have fevers, they would have chills, they would have pain, and they would say, please don't do this, right? Generally speaking, very acceptable to go ahead and experiment and try new things. And yes, your partner may find it very pleasurable. And so as long as you're doing it safely, ideally cut your nails if you have long nails, well lubricated, gentle finger. You can use a glove if you like, and go ahead and gently try.
Reminder, everything is under consent, guys. Don't do anything without consent. Consent comes first always. Let's get to the next one. What if I don't get a morning erection? Is that necessarily bad? Not that I always keep track, but sometimes I'll wake up with wood and sometimes without. Should it always be hard when I wake up? Jan in Norway.
Jan. Okay. So do you always need to have a morning erection? So what is a morning erection, right? A morning erection is when you wake up and you have an erection. It's not due to stimulation. It's not due to some dream you were having. You just wake up with an erection. Now, this is a normal physiologic process. In fact, the majority of healthy men will have 3 to 5 erections throughout the course of the nighttime. Now, there's a whole bunch of theories as to why this happens. Your testosterone is increasing overnight. You're also lying in bed and you may get friction from the bed itself. You may get friction from the sheets on top, but ultimately it's a normal physiologic process. Your body is getting signals and it's sending blood flow to the area and you're getting erections. So it's a sign that you have good blood flow, good nerve function, that your penis is receiving all the nutrients it needs to get an erection. So it's actually very, very positive when you're getting nighttime erections. Now, if you're getting them pretty consistently and you miss a couple here or there, you may just wake up and it may have gone away very recently. But if it becomes a long-term process, meaning that you're noticing that you used to get one every day and now you're getting one a week and now it's maybe one every 2 weeks, that may be a sign that you're having issues with blood flow or nerve function to the area. Now, blood flow issues, vascular erectile dysfunction is the most common cause of erection problems or erectile dysfunction. So if you start noticing that and you're having trouble maybe with erections with your partner, it's probably not in your head. It's probably there is a blood flow issue. It's really important to get that checked out because it can be a sign or a canary in the coal mine, we like to call it, for things like heart disease, because the blood flow or arteries to the penis are much, much more narrow than the arteries to the heart. So the arteries to the penis are about 1 to 2 millimeters, whereas the arteries to the heart are 3 to 4 millimeters. So when you start having issues with blood flow, you're going to see problems in your penis before you see them in your heart. So it's important to talk to your primary care doctor, get your heart evaluated, get your sugars evaluated, make sure you're not diabetic, get your cholesterol checked, all those things to make sure there's no hidden problem that you maybe haven't addressed that's causing these blood flow issues.
Right on. I'm going to have to start keeping track of these things in the morning. All right, next one. I'm in my 50s, been noticing my urine will occasionally look more orange than what I traditionally remember it looking like. I keep a water bottle on me, so I do drink plenty of liquids. Should I be doing something different? Layla from Vermont.
Layla, urine color. So I love urine color because I tell people it's a great way to gauge your hydration. So just for everybody in general, when you're drinking water, you don't want your urine to be clear. That means you're probably drinking too much. And you don't want your urine to be dark yellow, right? Because that's a sign that you're probably a little bit dehydrated. And so I tell people, make sure your urine looks like lemonade. Now, what can change your urine to be orange? So orange color urine can be due to things like eating a lot of beta carotene. So things like carrots, for example. Certain medications can cause your urine to be orange. So we often give a medication called Peridium, or you can get it over the counter, called Azo, where it turns your urine orange when you take it because it's going to help with pain in the bladder. So often people will use it for symptoms like they think they might have a UTI or urinary tract infection, and they'll take this medication and it will turn their urine orange. There's also other medications like rifampin, which is for tuberculosis, and other medications like that, which if you're taking could change your urine color. Now, if it's happening once in a while and it's mostly clear, I wouldn't worry. It's probably just something you ate. Just increase your hydration and see if that clears things up. Now, if it's persistently orange, I would definitely see your primary care doctor to get your liver function and your kidney function, all those things assessed, because that is the other thing that can sometimes change urine color is if you have a malfunction in one of those organs that's causing your urine color to change. All right, thank you guys. If you are enjoying this Ask Me Anything, check out our membership at renamalik.supercast.com, where you have exclusive access to the entire AMA. So you get to watch the entire AMA or listen to the entire AMA on the podcast. And you also get early access to all the podcast episodes, both video and audio, ad-free. And you get an access to Ask Me Anything. And these are questions that we look at every time we do an Ask Me Anything. And these are the questions we pick from first when we answer questions online. I hope you guys enjoyed this. As always, remember to take care of yourself because you're worth it.